to Rotemberg Plastic Surgery. I'm Dr. Baotram Tran. I'm a board certified plastic surgeon.
I'm Silvia Rotemberg. I'm also a board certified plastic surgeon, and we're happy to be here doing our first video.
Yeah, so we just a little bit of review about breast augmentation today.
Right. And what are the most common questions patients ask us when they come here for breast augmentation? Dr. Tran and I, we tend to do a natural looking breast augmentation. So patients that want to have the procedure done, but it still look natural, that some of their friends won't even notice. Sometimes not even the husband will notice that they had a breast augmentation procedure. Of course, if you want to be noticed, we can do that too.
Yeah, I think the focus of our practice is to make something more natural because it would give you a much longer lasting result. You want something that looks natural, not just now, but 10, 15 years down the line. I think that's something that people don't talk about with very large implant that
Right.
It might not happen.
Right. And the other thing that implants are not permanent. So if you have a breast augmentation with an implant, doesn't matter if it's saline or silicone, you will have to have that replaced with anywhere from 10 to 20 years. We really don't know with the new generation implants how long they will last, but just keep that in the back of your mind. They're not totally permanent devices.
There are two types of implants. There's a silicone, this is the one that I'm holding right now. The other one is a saline breast implant.
Yes, and we like to do silicone implants. At least I do like to do more of a silicone implant. I feel the saline implant, just that movement of the water back and forth, can stretch your skin. So with time, the silicone holds the breast shape better than the saline.
Right. I think the other questions that a lot of patients ask is where will that scar be? So typically, I think the one with the least issue and complication in the future is the one under the breast. What do you think?
Right, that's right. Because if you have to have that implant replaced or removed after your first breast augmentation, we always have to go under the breast. So why have another scar that first time? We just do one and that's it.
Right, and then also from what I noticed that with the scar around the areola or the dark part of your nipple, they tend to stretch over time and it becomes pretty prominent.
Right, and yes, also. And you can have some bacteria infection when you go through the nipple.
Right.
So we do prefer the under the breast fold, and it's hidden pretty well.
Yeah, I think most people are very happy, and even without any clothes on, it's very difficult to notice the scar because people heal very well.
Yeah, and when you come here to the office, usually the way the consultation works, Dr. Tran and I will see the patient, and we'll have you try sizes in the office so you feel comfortable picking a size that will be best suited for you. A lot of times patients come and they take pictures and they go home and they discuss with their husband or significant other if that's a good size or if they want to go a little bit bigger. We usually recommend a size that is based on your breast diameter, and we don't recommend going too small because you're having surgery, right?
Right.
You wanna show your boobs. But we usually help you pick up the right size for you.
Right. I think choosing the right size for your body frame is super important. Like we mentioned earlier, that it will give you a much longer lasting result versus choosing something too large for your frame that your tissue can really stretch out, in a couple years, that you might need more surgery to make it looks more rejuvenate or your breast looks more youthful again. So.
Right. And the procedure is done as an outpatient surgery center. It's in and out. The surgery, with anesthesia and everything, it doesn't take too long. But you have to have someone taking care of you that day just because you underwent general anesthesia. And but the recovery is pretty quick, right, Dr. Tran?
Yes, absolutely. I think most people have discomfort for 1 to 2 days. Some people don't even take much pain medication besides Tylenol. And then I think the biggest restrictions for me is, you know, no heavy lifting for about 2 weeks.
Correct.
And then until you heal up, you can't submerge in the water. But that's about it.
Right. Yeah. So it's a good procedure, and some of the common complications, you can have infection, bleeding. If anything happens, usually happens in the first 2 weeks. What we usually tell our out-of-town patients is that you know, to prevent many complications, they should fly in the day before this
Right.
procedure and stay here if you can at least 2-3 days, and then we can follow up with you virtually.
Right. So we follow our patient very closely. If you're in town, usually we see you once a week for at least the first 2-3 weeks to make sure that everything goes well. And obviously all your post-operative visits are included in our service.
Right. Yes. We can see you every day, and it's included. Don't worry about it.
You might not want to come every day, but yeah, you know, we're very proud to provide, you know, our services. We provide the care that the patient deserves, and we do care about our patients, and that's what we want to do.
That's right. If you have any questions, you know, you can call us or email us, and we'll be happy to answer your questions.